In this next segment, we are going to review some new concepts in brain and spine intervention. Beginning with spine intervention, we look at patient management, which includes the diagnostic evaluation of a patient with symptoms related to the spine. This includes a complete physical history, image studies, as well as image-guided injections, which may be both physiologic blocks or provocative studies such as discography to elicit the cause of the patient's pain, or the so-called pain generator. This is requisite for effective therapy because optimizing therapy requires a precision or precise diagnosis. Treatment can be conservative, non-invasive, such as medical or physical therapy, minimally invasive, including diagnostic image-guided injections or therapeutic injections, as I mentioned, minimally invasive surgery, or open surgical procedures. Open surgical procedures certainly can be effective, but there are a number of problems with large surgical procedures. For example, a multi-level fusion may lead to premature adjacent segment degeneration. Failed back surgery syndrome is not uncommon in patients with multi-level fusions and other large invasive surgical procedures. Instrumentation failure can occur, or fracture of the hardware itself, or loosening, migration, and other causes for instrumentation failure. An open laminectomy in a patient with multi-level spondylosis and stenosis, as you see here, certainly decompresses the canal and relieves those nerve roots of mechanical compression, but can lead to an unstable spine if they aren't instrumented and fused, and they may benefit from a more minimally invasive type approach or minimally invasive procedure. We have less blood loss. You don't have to put the patient under for as long, or sometimes not at all. Soft tissue damage, which is pretty extensive with open procedures, is much less, as is the risk for infection and cosmetic outcomes that are untoward. As far as post-operative sequelae, less pain, less need for analgesics, shorter hospital stay and recovery time are all benefits of minimally invasive surgery. We can do, for example, procedures that can require only minimal incisions or even a puncture wound to install medications, to install even instrumentation or hardware, such as an intraspinous spacer, or even fusion cages and instrumentation through minimally invasive procedures that involve minimal soft tissue damage and small